at the European Centre for Environment and Human Health at the University of Exeter.
Okay, and if you look at me...
Right, sorry.
Philippa, that was for my filing, thank you. So on Philippa now, yeah.
Okay, so
Right.
just to start with, Smartline, can you tell me a bit about the background to the project, how long it's been running and what it's involved?
Yes, certainly. The Smartline has been running since 2018-19. We were very fortunate to receive funding from the European Regional Development Fund, and we are focused on looking at how digital technologies can support people to live healthier, happier lives in their homes and be better connected within their communities. The project's original aim was to look at the role that everyday technologies can play and how we can make better use of the data that we can collect from people, both in terms of their home environments and their personal habits and behaviours and desires, to inform and influence service provision to particularly vulnerable groups. So looking at people who are in housing association homes, who may be on lower incomes or who may have particular health conditions.
And so what did you actually do in terms of, in physical terms? It's pretty groundbreaking, the size and the scale of working with the community.
Yeah, the project is started by recruiting tenants from Coastline Housing. Coastline Housing are a key partner with us on the project, and we were able to recruit over 300 households to the project, and each of those households very kindly agreed to have environmental sensors installed in their home, and then also took part in a variety of data gathering questionnaires to allow us to put a picture around the data that we were collecting about how their lives were and where their priorities and challenges were.
And so through doing that, what have been the key learning points and insights, would you say?
I think one of the things that has come out of the project is the value of environmental data to helping to support both how housing association services are delivered to their tenants, but also the wider social context about the conditions and challenges that people are facing, particularly when they're on low incomes or are older and are feeling isolated, and the added value that digital technology can bring to people's lives, but I think with also recognising that many households in those categories of lower income face challenging access to digital technologies, and we need to be very aware of that when we are designing services so that we don't unintentionally exclude people and add to the inequalities burden that they already face.
And obviously the project running through a pandemic and lockdown, what happened during that time?
A bit of DIY.
Yeah, what happened during that time and what did it allow you to do?
The pandemic threw up some really interesting challenges for us. We were able to continue to collect data from people, but we weren't able to do some of the more face-to-face activities that we'd had planned. So we did refocus our efforts within the project to looking at the digital inclusion and exclusion agenda. So looking at the value people gained, particularly during lockdown, of digital communications, how we could support people to gain access to video calls and enable them to maintain contact with each other and with their families who are further away. And I've completely forgotten the second half of the question.
Really, I'm just sort of trying to get an understanding of what you did, that had to pivot the project, but also it's a unique experiment, so to speak, to see how people sort of adapt and what the challenges are in terms of digital, because we all started to rely on it much more during that period.
Yeah, so I think what Smartline was able to do in the COVID pandemic was to explore the digital agenda, look at how people were able to use technologies, and also, also importantly, how people weren't. So there was an assumption that there was a fairly straightforward and simple explanation to why people weren't using technology, and therefore an easy solution to that. So Smartline was able to use the data it was collecting and the participants that we had to really understand and get under the skin, if you like, of digital exclusion and exclusion. And I think we were able to support local businesses to understand how they could pivot their own services into that digital space so that businesses were able to continue to trade over the pandemic period. And I think what we've been able to show is that digital technologies have a real role to play, but it doesn't come without consequences, and we need to be very aware of those consequences to ensure that we are addressing the inequalities that exist in society.
How important would you say is it in putting together a project like this with multiple partners and only engage from a sort of scientific survey data perspective, but to also look at personal community involvement?
I think what Smartline shows is the incredible value and need to involve the end users, who are the tenants and the occupants of the homes. The insights that we've gained on how people need to have access to the data to help inform their own decision making, but also then how providers of services need to interact with people in their homes in order to ensure that they get best value from the services that are being offered, and the data that they are choosing to share is really important. I think looking at how people's different levels of engagement with data is a really important point, and understanding what people really need to know in order to make changes to improve their health and well-being. So, for example, looking at the internal household data, knowing what the temperature is isn't necessarily the most important fact. Knowing whether it's good or bad for you and what to do about it, how to make change, is the important part.
And what would you say, looking at local authorities, social housing providers, companies that are working into this space, what sort of questions should they be considering in terms of taking this, I don't want to call it a market, but this offering and service forward?
I think in terms of developing a commercial approach to the idea of providing internal sensors, I think it's about understanding the breadth and scope of the potential of that service, so that when they're thinking about the costs of installing a network, really understanding that it has added value in a whole range of areas that may be unexpected. Not only does it help individual householders manage their own environments, it allows housing providers to better manage the services that they provide to those tenants, and to improve their own internal services and stock maintenance, for example. But then it also provides an additional layer of looking at some of the forthcoming challenges. So thinking about climate change and how do we manage our home environments to address the changes that the climate and challenges the climate is going to put on us. These are all things that are, add value. But one of the interesting things that's come forward is, by having this data, housing associations are able to intervene earlier, so which means that their own staff are dealing with people who have a problem rather than a crisis, and that reduces staff stress and pressure. So all of these things, there's a sort of multi-layered approach, and it has value in different places, and recognising the real value of a system like this actually, I think, is possibly one of the challenges for implementation.
And looking forward, what's the potential now for this work, and what other areas or questions have been raised that now potentially need addressing, thinking about health, and what more evidence is needed? I suppose it's the value of the evidence.
Yeah. We're now looking at looking at that interface between the health service and the housing sector. So looking at how we can use internal monitoring to both enable, for example, patients to come out of hospital sooner because they will be digitally monitored, and so don't need quite so much face-to-face attention from clinical staff, but also thinking about, are there ways of looking at how do you prevent illnesses becoming more acute, or how do you prevent or improve the circumstances in the home to prevent health health.
If we start that way,
Yeah.
I think it's quite important.
Yeah.
So just in terms of what's next and what the potential, can you talk about that?
Yeah, we're now in discussion with other partners to explore that interface between the housing sector and the health services. So looking at how we can use this form of technology to enable, for example, patients to be discharged sooner from hospital, and looking at how clinical care can be provided at home, sort of the virtual ward at home, if you like, but also thinking about how do we improve the home environment in such a way that it prevents the development of conditions, so that we improve people's health and well-being prior to them becoming patients of the NHS and the health services, and maintaining better long-term health outcomes.
Just lastly, all of those things can sort of ring alarm bells for some people, both in terms of collection of data and also replacement of care with tech. How do we address that area, and what are our recommendations or caveats to that?
I think one of the things that's come from Smartline is very clearly that human interaction, person-to-person engagement is really important. What the technology does is allow you to target your services more effectively. So you're not removing face-to-face interaction between people, but you're ensuring that it goes to the people who really need it. There are some people who are happy with being digitally monitored. There are others who desperately don't want that. And what we're able to do by using the data that we collect is ensuring that the people get the service they need and they want, and that we are maximising the value of that interaction by really understanding the problems and challenges that people are facing.